Good morning. My name is Jeanette Goodell. I am here to present my MSN Population Health Comprehensive Teaching Plan to manage diabetes mellitus type 2. My population of interest are those individuals age 45 and older. My project took place in Marion, Alabama, in which in 2014 there were just under 3,500 individuals living in the city. The issue of concern is diabetes type 2, in which there are several types of diabetes: type 1 juvenile onset, type 2 adult onset diabetes, and gestational diabetes. Juvenile diabetes usually happens in the younger population, and type 2 usually happens in adults, but now they're seeing it more in children due to the fact of the high obesity rate. Gestational diabetes happens during pregnancy. Type 2 diabetes is when the body makes insulin and the body doesn't respond to it, or the body doesn't make enough insulin. Diabetes affects an estimated 21.9 million people, according to Healthy People in Healthy People 2020. Uncontrolled diabetes can eventually affect the eyes, causing blindness, heart by causing increased cholesterol levels, kidneys causing them to shut down, and limbs causing decreased sensation. The Advanced Population Health Nurse, the 5 roles. According to Healthy People 2020, the goal is to reduce the burden of diabetes mellitus and improve the quality of life for all individuals who are at risk for diabetes. The researcher. This person is the investigator, they're a collaborator. They answer questions in regards to healthcare. They do multiple researches on diabetes. The clinician, they perform assessments, identify the need, and plan and implement it, evaluate the community. So this person is going out and they're trying to figure out, okay, hey, what can we do to make this, what is the problem and what can we do to make it better? The educator will educate the community. They will hold forums, educational health fairs to get the public out, to make them aware of what's going on in the community. The collaborator and consultant, this person collaborates with other healthcare professionals to see what kind of treatment options can be made possible for the community. The advocate or change agent speaks on the behalf of the community. This is the person that reaches out to legislators and the community leaders, and to see what they can do to make the community better. Healthy People 2020. According to Healthy People 2020, the goal is to reduce the burden of diabetes mellitus and improve the quality of life for persons who have or are at risk for diabetes. It is optimal to have an individual's A1C below 7. So some social determinants to diabetes are access to proper health care, availability of resources to meet daily needs, availability of community-based resources in support of community living, and opportunities for recreational and leisure time activities, social economic conditions, and language literacy. This is according to Healthy People 2020. So some interventions. The clinician, as stated before, they'll assess the community, they determine the need, develop a plan with implementation, and they set goals. The collaborating consultants, they meet with community leaders, they formulate a plan for the community. In addition, they also may consult with physicians and other healthcare providers of the city to see what plan they can come up with. Interventions continue. The educator, they hold community forums. So just like they can host health fairs, provide educational handouts to the community. A lot of times people don't like to read. They would prefer for you to tell them something. So that's where the community forums will come in handy. Consult with other healthcare professionals to formulate a plan and implement that plan. The researcher, they perform literature reviews. They develop a new plan of action. Collaborate with other healthcare professionals to develop a new plan of action, and then they implement that plan of action along with every other role. So as you can see, these roles tie in together. The advocacy role: speak on patients' behalf and the community's behalf, engage patients and community in healthcare, educate community leaders on healthcare problems affecting the community. Literature review. According to CDC, in 2015, more than half of the new cases of diabetes were among adults aged 45 to 64, and the numbers were about equal for men and women. And it also stated that if you eat more complex forms of carbs such as nuts, seeds, whole grain, bread, and pasta, fruits, and vegetables, this will slow the rise in blood glucose levels after a meal, so therefore not causing diabetes. Usually a lot of doctors like to use metformin as the first line of treatment to try to lower the blood sugars. So environmental, individual and agent factors. Modifiable risk factors are being overweight, smoking, heavy alcohol consumption, being inactive, diet high in sugar or carbohydrates. Non-modifiable factors: family history, age, race, and ethnic background. These are some evidence scholarly articles. Summary of rapid appraisal check from Article 1. It was a study done on individuals 25 to 64 with 2,300 participants. They had two groups, one with pre-diabetes and one that was diagnosed already. So the outcome, they did face-to-face conferences to collect the data. Some Article 2, there were just over 1,100 individuals. They had two groups from various backgrounds with various medical histories. The study found that type 2 diabetes was higher in men than women. Article 2, there was a cohort study done in the incidence of type 2 diabetes with 869 participants. They took all kinds of measurements. Prior diagnosis of diabetes, you were disqualified. At the completion of the study, 190 individuals were diagnosed with type 2 diabetes. So some primary, secondary, and tertiary prevention efforts. Primary prevention, you want to promote exercise, healthy diet, weight loss. Secondary prevention, you want to keep those same things from primary, and you want to add in a hemoglobin A1C, fasting blood glucose, glucose tolerance test. On over to tertiary, you want to keep all of those same things from those previous preventions and add on medication. Most effective interventions with sub-roles. So with the researcher, they can formulate a detailed literature review and develop a plan of action for individuals 45 and older with type 2 diabetes. The clinician develops a plan of care, implements that plan of care, and evaluates it for the type 2 diabetes. They collaborate with other healthcare professionals and assist with primary, secondary, and tertiary prevention. Educator, they can host informational sessions on how to manage this disease. Advocate change, speak on individuals' behalf that have type 2 diabetes. Nursing theory versus borrowed theory. I chose Virginia Henderson, the definition of nursing. Her theory basically, to me, is a holistic approach during care. They do spiritually, emotional, physical, social, and intellectual. Summary of assessment of needs assessment. All levels of prevention are needed to be addressed. Primary and management of prevention and management of diabetes revolves around healthy diet, exercise, and weight control. Priority educational plan. We're doing a primary prevention would be priority. The education plan will talk about exercise, weight control, and healthy eating. Proposed plan. The participant will exercise for 15 minutes every day until they can reach 45 minutes for 5 days. They eat a healthy meal with three snacks in between each meal and a bedtime snack. And if they're overweight or obese, they want to try to lose weight. This is one of the educational handouts that I used during the presentation. Some geographical location. Marion is the House seat for Perry County, and it is located in the Black Belt of Alabama. Significant trends. They have in Marion they have a company called TechPec that employs majority of the city. Others travel away from the city for jobs. Local government, the mayor is Dexter Hinton and was elected in 2018. Key leaders, Frances Ford, RN, she's a community health nurse. U.S. Congress representation, Doug Jones is Democrat, Richard Shelby is the Republican, and Terry Sewell is the Congresswoman. Ralph Howard is the representative and serves as District 72. Health policy, achieving healthy equality in United States policy. Social determinants for type 2 diabetes, access to care, individual resources. You always want to follow the 9 provisions by ANA for the Code of Ethics. Nurses should always advocate for their patients. Marion has a size of just over 3,500. Per capita income is just a little bit over 12,000. This is some information on education for the residents of the city. Diabetes account for 61,458 as the incidence in the city. 5 most reportable communicable diseases. Crime rate and abuse statistics. Births to deaths. The windshield survey. I spoke with Dr. Lee in regards to problems within the city and things to make it better. Also spoke with Frances Ford in regards to some issues in the city, and she stated that they needed a critical care access. These are my 3 community priority diagnoses. My diagnosis: risk for unstable blood glucose related to deficient knowledge for diabetes management plan, as evidenced by 80% of Perry County residents participating in diabetic monitoring. An overachieving goal would be to present an evidence-based educational plan to patients age 45 and older in the Marion Clinic to improve blood glucose levels and decrease hemoglobin. These are my measurable plan objectives. This is the detailed plan for intervention. Some potential resources that I would possibly use. Barriers that I may face during the project. Team members to get the project implemented. Some key stakeholders. And that is the end of the presentation.